How do you know if the dosage you have is the right dosage? Why is the process taking so long? Well, today we've got Dr. William Dodson joining us again. He is a board certified adult psychiatrist who was one of the first practitioners to specialize in adults with ADHD over 25 years ago. He was named Life Fellow of the American Psychiatric Association in 2012 for his work with adult ADHD. Dr. Dodson, you're becoming a common recurring guest, and I'm really honored that you're coming back. And thanks again for joining us today.
Thank you for having me.
Today, we want to talk about resistance to medication. So people's resistance to medications, be it a family member who has a loved one that's taking stimulant medication for ADHD, or the patient itself. Like, I went through that resistance a little bit as well. So in all your years, you've ran into a lot of people resisting the medication. Can we start there? And what do you think is the main reason or reasons for resisting to take medication for ADHD?
Well, there really shouldn't be a problem. These medications are some of the most effective and safe medications that have ever been brought to medicine. Tremendously effective, an effect size of 1.8, which is better than anything else in medicine. They're incredibly safe. They're safe enough that we give them to small children. Amphetamine's been FDA approved down to the age of 3.
Oh, wow. Yeah.
We even with pregnant women, there's now a very good body of research to show that these medications are safe in pregnancy, because you'll get people who wring their hands and say, oh, we don't know what these medications are doing to developing nervous systems. Yes, we do. And people who have taken these concerns very seriously have researched all of them and just not found anything that is dangerous to them. Most recent one was looking at cardiovascular disease at all ages, child, adolescent, adult, and the elderly. And what they found was that these medications are cardiovascularly safe, even in elderly people with heart disease. They're that safe. So what we deal with are concerns. People are concerned, they're worried. But then they don't actually look to see what the actual situation is. Part of that is due to the fact that back about 2000 to 2005, there was a group that had a disinformation campaign against psychiatric medications, and in particular Ritalin. And they did a marvelous job of placing the idea in the collective unconscious of the United States that it was the treatment of ADHD that was dangerous, not ADHD itself. And so when people start to think about, well, should I consider even going in for an evaluation? Because I know that, medication, or at least a recommendation for it, can be part of that. They're struck down with fear, and they end up doing nothing. Again, the patients I saw were the people who decided to come in and at least give it a try. I have no idea how many people never made it to my office,
right,
due to that fear.
So you're saying a lot of the resistance is also basically the resistance of getting diagnosed because of the resistance to medication?
Yes.
Okay. That's interesting.
People know that when they call somebody who's an ADHD specialist, medications are going to be right at the forefront of the things that are going to be discussed, and the options of what to do about ADHD.
Right.
There are 11 international treatment guidelines, and all 11 of them list medications as the treatment of choice, period, full stop. Not multimodal therapy, or medications, period. So yeah, medications are by far the most effective treatment of the core symptoms of ADHD. But most people don't know that. They don't know that it's that strong, or that we have 80 years worth of research to show that they're safe. Again, the decisions are made for largely non-rational reasons. One thing is, people don't know what the risk is of non-treatment. Just doing it's a litany of life's ills. Russ Barkley looked at life expectancy. An untreated ADHD takes 13 years off a person's life. I mean, these are not minor problems. We're talking about a loss of 13 years. To put that in perspective, that's the same thing. That's the same loss of life expectancy that you would have with type 1 diabetes or heart attack.
Right.
So it's that serious. Um, there's a 400% increase in accidents severe enough to produce a hospital record. There's a 60% chance of developing a substance use diagnosis of people trying to self-medicate their ADHD with alcohol, marijuana, cocaine. It's not whether people are going to take medication, it's which one they're going to take to self-medicate.
Right.
There's a 1,000% increase in unplanned out of wedlock pregnancies. There's a tenfold increase in the risk of somebody trying to commit suicide. And that when you treat the ADHD, that all these things go back down to zero. For little kids, people look at academic performance and stuff like that. But the thing that makes mothers cry in my office is not the fact that their very bright kid is flunking out. What they cry about is the child never gets invited to parties. They have no friends at all. And this is caused by the ADHD, and in particular, the outbursts of temper, of emotion, meltdowns, and things like that. Other kids don't put up with that. So there's a nice article by Mikami that says 70% of third graders with ADHD do not have a friend. That's a profound problem. So doing nothing is not an option. It's the longer you wait, the more damage is going to be done.
And like you said there, one way or the other, they're going to take a medication, be it a stimulant or a substance that you could become with a substance abuse disorder.
Right. And primarily what they're trying to self-medicate is the hyperarousal of ADHD.
Mm-hmm.
They want to slow down a lot of times just so they can sleep at night. Because the hyperarousal, hyperactivity component of ADHD gets much worse at night than it is during the day. And people just can't settle down enough, shut their brains and body off to go to sleep. So that's why 60% of untreated ADHD people end up with a substance use diagnosis.
That's a big number.
It's huge. It's huge. There are other reasons. Another good article by Jelinek said that by the time a child's in the third grade, they have heard 20,000 additional negative or corrective messages in school alone. Mm-hmm. Sit down, stop that, be quiet. You're stupid. You're lazy. This is a constant bombardment to kids with untreated ADHD. And 20,000 negative or corrective messages is going to have a detrimental effect on every child. I don't care who the kid is or how well they're loved at home. Being told that 20,000 times by the time you're in the third grade is going to have a huge effect on who you think you are and what you think you're worth to other people. Kids with ADHD are constantly being told that who and what they are is not wanted, and they better be different in a hurry.
Yeah, and then your brain does maladaptive protection mechanisms that have ill effects down the road in life with that kind of experience. So what do you think is the resistance to taking medication? Is it more the patient, or let's talk about kids right now. Is the resistance more about the parents?
Yes.
Having them take it?
Yeah, it comes in two ways. One that I'll hear very commonly from parents is, I don't want my child to be labeled.
Right.
Labeled as ADHD. And my response is, honey, they are already labeled. They're the disruptive kid, the bad kid. I had one woman say, I don't want my kid to be labeled. He's just lazy. I said, do you realize that lazy is a label?
Yeah.
That you just put on your child? He is going to be labeled. He has already been labeled. And what you're doing is you're perpetuating that label. You're letting it do more damage for a longer period of time.
And we could do
Uh,
that to ourselves as adults too.
oh yeah, I mean it becomes internalized, and adults do it to all day long, every day. Uh, and they make predictions. Oh, you can't do that because you're such a failure. It has lifelong problems.
What other misunderstandings around medication are there besides, just the side effects or the label? Um, I've heard some
Um,
people say that I will no longer be the person I am.
right. They fear the zombie effect, slang in the field, that it'll take away a personality. Okay, that is not the failure of the medication, it's the failure of the prescriber.
Oh, okay.
People with ADHD have what they call the paradoxical reaction. If they take medications with stimulant properties, they slow down. Well, if they take too much, they slow down completely, and they lose facial expression, they lose initiative. Now the teacher likes it because the kid's no longer tearing up the classroom, disruptive and obnoxious. So, teacher's perfectly happy with it. But again, the child has lost their personality, and that's not good. The thing is, that's a measure of the dose being too high.
Right.
And the person who prescribed not knowing that and just recommending a lower dose. With these medications, more is not better. All the medications have to be fine-tuned to the unique individual. The old saying that if you know one person with ADHD, you know one
Yeah.
person with ADHD. Well, that's immensely true with the medication component of treatment, is that everything has to be fine-tuned to that unique individual. The right molecule, the right delivery system, the right dose,
Yeah.
and the right timing of dose.
Yeah, and I think that deserves a whole conversation on its own, which I think we should do that at another time.
Yeah.
So besides the misunderstanding, we got this misunderstanding of medication, but another thing, is it true? What this is just based on my observation. The other misunderstanding about medication is it solves everything for you.
Yeah, that's an over expectation of what the medications can do. So you have to start with why are you here? What do you hope that the medication will actually do for you? And a lot of people come in with completely unrealistic um, expectations. Probably the biggest one in the studies that have been done about why people don't stick with medications is what they call the antibiotic fantasy. That people think of them as antibiotics. I'm going to take this medication for 2 weeks, maybe as long as a month, and I'm going to be cured, and that's going to be the end of it. And so at the end of a month, when they still have ADHD and they really notice it when they're not taking the medications, they say, oh, the medication didn't work because I've still got ADHD. I can tell you for the people who come back to see me as adults who stop their medication in adolescence, that's an almost universal fantasy. The medication didn't work because here I am, I've still got ADHD. And most people do not want the notion of, I've got a condition that's going to require that I take a medication to manage it every day for the rest of my life. But that's also what medicine is.
Right.
Medicine is the treatment of chronic illnesses so that the person can have the most fulfilling life possible. So in that, it's no different from any other medication. It's just people have totally unrealistic expectations or fantasy wishes. I wish this would just go away.
Right.
Yeah.
But it's not only medication that we take, it's other aspects too as part of the treatment, right? There's like the
Yeah,
three, and then we got the medication, the education, and oh, I'm blanked on the
psychotherapy to
third.
go back and
And therapy. That's right. Yeah.
repair some of the real severe damage that was done during the time when the person wasn't diagnosed and set up for failure
Yeah.
constantly. Yeah, managing ADHD, especially the first year or so, is a lot of work. And a lot of people just um, haven't gotten to the point where I can't stand it anymore and I'm willing to do what it takes. I always say that no matter what the person's diagnosis is, I could always tell in the first 5 minutes whether or not my new patient was going to have a good outcome. And the ones who were going to get a good outcome had what I call willingness. I've got a problem here that I'm coming to you for help, but I want you to know I am personally willing to do whatever it takes to get control of my life. That
Hmm.
person, regardless of their diagnosis, is going to do well. Somebody who comes in and says, I'm going to take a pill for a couple of weeks and it's all going to be gone, and I'm not willing to do more than that, is going to have a terrible outcome, which they will blame on the medication rather than their attitude is such that there never was a chance of success.
Yeah, a bit of a victim mindset there.
Well, again, most people don't want to do a lot of hard work. And that's what, getting control of an entire lifestyle and nervous system, that's not a simple or trivial problem. It's not going to have a simple or trivial response. It's hard and it's hard work. And a lot of people say, well, it's just too hard for me to I can't be bothered.
Right. But that for a few of the examples that you're giving us, it's a lot of they think it's a condition that'll just go away, like like a cold, or
Or he'll grow out of it. Just wait
yeah,
long enough, he'll grow out of it, which of course never happens.
yeah,
You can't name another genetic disorder that goes away with age. You can't name another neurological disorder that goes away with age. There's no reason why we should expect, our kid's 18th birthday, they open up a new, beautifully wrapped package. Oh, just what I always wanted, a new genetic code. But that's how they think that, some miracle is going to happen, about their 18th birthday, and they're not going to have to contend with this ever again.
that's a lot of social conditioning as well. It's a problem. People just want to get rid of that label because it's misunderstood. Still, it's a lot better than it was for understanding clarity, but there's still a resistance to the label as neurotypicals.
Right. And that also is one of the big resistances that parents have, because they know that there's somebody out there who's going to get on their case about having tried medication for their child. In my family, it was Aunt Sally. Aunt Sally never had kids of her own, but she was first in line to tell you what you were doing wrong with your kids. And she was referred to as being often in error, but never in doubt. And so she would be the first one to come in and say, how could you do that to your child? Again, she's one of the people who sees treating a disorder as the problem, that's what's doing harm, is the treatment of the condition and not the condition itself.
So, what is the biggest frustration with medicine treatment that's out there for? Well, I guess it would be for the patient. Besides, it's not taken enough. Some of do the techniques work? Are they applied properly?
Probably the biggest problem is access to clinicians who know what they're doing.
Mm-hmm.
In the American Academy of Pediatrics' most recent guideline update, they pointed out that 50% of pediatricians acknowledged in a survey that they were not competent to diagnose and treat ADHD. Half of pediatricians. So it's probably more than that.
And it's not their incompetence; it's just their training didn't really provide them that support.
Complete lack of training.
Yeah.
And it's even worse for adults. 93% of adult psychiatry residencies never mention ADHD in 4 years of training. There's never been a single question on ADHD on the psychiatry board examination. It's just an ignored condition, completely ignored. And it's a huge failure of establishment medical education, because this is 1 in every 10 people. So every physician, statistically speaking, is going to see 3 people with ADHD every day. A psychiatrist, 1 in every 5 people that walks in their office is going to have a diagnosis of ADHD as either a first or second diagnosis. And they don't even think to look for it. Now, this is why diagnosis in the United States is largely done by the patients themselves.
Mhm.
The teachers don't know about it. The doctors don't know about it. So they go out and they figure out the diagnosis on their own. And the federal government right now is wringing its hands about, oh, these people must be abusing it or they're self-diagnosing. They're not happy to do that. They're doing it because every teacher they ever had failed them, every doctor they ever had failed them. And because ADHD is so genetic, half their first degree relatives are going to have ADHD. And the story I heard over and over again was I was at a party with my cousin who was really kind of a screw up. And now he's just a totally different guy. His life is so much better. And of course, I wanted to know why. And he says, because I got diagnosed and treated for my ADHD. And I keep talking, and my patient goes, wow, I was exactly that way. And so my next question is, and when you tried your cousin's medication, what dose worked best? Because I know that's what happened. They tried the medication. It worked wonderfully. And so they're doing the right thing by coming into a doctor to get their own prescription. But unfortunately, that is what we forced people to do
Right.
by
Yeah.
not having any alternative. So the first thing I tell most people, whenever I do presentations for lay audiences, the first question every single time is, how do I find somebody? How do I find somebody who knows what to do? And the only answer I've got for them is go to a CHAD meeting, go to an ADA meeting. These people were in your shoes a year ago, and ask them who's good, who's not. Let them do your investigation for you, your due diligence.
Do you think a lot of the misinformation or the misunderstanding of stimulant medication may have a lot to do with, like, I know in Canada, I'm assuming in the States as well, they're on a list of controlled substances, which is
Yeah.
assumed to be a narcotic. And then it just gets wrapped around in that mantra of, oh, it's got to be heroin or methamphetamine, but it's not the same.
Yeah. Many people equate amphetamine and methamphetamine as being the same thing, even though if they really stopped and thought about it, they know that they're not. One of the things that, indeed, what we've been discussing so far is that people don't take the medication. They don't stick with it. Therefore, they're not addicted. And what we know is that most people stop the medication because they hate how it makes them feel.
Right.
These medications for people with ADHD do not get them high. They are a return to normative level of functioning, what many people call the best version of themselves. But that's basically putting them back where they have the same chance that everybody else does. It
Mm-hmm.
levels the neurologic playing field so that they have an equal chance for the first time in their lives. They do not get high.
No, actually slows the brain down a little bit for us.
Exactly. And again, this is also, on top of a huge amount of evidence that says the ADHD nervous system is fundamentally different than
Mm-hmm.
the neurotypical nervous system. And yet people want to think about them as if they're the same. Um, and they don't know what they know. People know that these medications, if they're improperly managed, are unpleasant. They don't
Yes.
get you high.
Yeah.
And so, they put restrictions on the people who actually have a reason to take the medication um, and do not abuse it because it has that self-regulating quality that if you even go 2 or 3 milligrams too high, it's an unpleasant feeling.
Mm-hmm. Yeah, it's a tricky, it's not like you weigh 100 pounds, therefore it's this milligrams.
Right.
It's quite the system and methodology. So for to end this here, because we're starting to run out of time, is what would you recommend or what would you say to people who are resisting taking medication, maybe from two different angles, from the angle of the patient who's making the conscious decision to take medication on, or from a loved one, a parent or a spouse wanting, having to decide if a loved one will take it that's under their care?
Okay. Two very different questions. One of the things that I found to be very helpful is just to ask the parent who's very reluctant, or indeed there's one parent that just absolutely puts their foot down about, oh, I'm not going to have my kid on medication. And said, look, as a parent, that's what you have the right to do, and I'm sure you firmly believe that you're doing what's in the best interest of your child. But there's something you need to know. 10 years from now, your child is going to come to you and ask a question that you need to be ready to answer. They're going to come and they say, Mom, Dad, back in 2025, you knew I had ADHD. You knew I was flunking in school. You knew that I had no friends. You knew that I was self-medicating with marijuana that I got from my friends. You knew I was floundering on every aspect of my life. And let me get this straight. You did nothing. You didn't even give me a try to see what medications could do for me. I was sinking, I was drowning, and you did nothing. Get started right now because you're going to need 10 years to come up with an answer for your child. Mm-hmm. And that's exactly how it happens, by the way. And the parents know that. And so what that does is they know they're going to be criticized by people that they despise. Aunt Sally, nothing but a pain.
It's true.
That's sort of the immediate fear. I don't want Aunt Sally on my case. But if they know that there's going to be somebody that they care deeply about who's going to be critical of them for doing nothing, that all of a sudden changes the equation. For people who are brought in rather than have bought in, it's an entirely different story. The motivation for treatment is in somebody else. And indeed, there's almost a resistance to treatment because nobody likes to be coerced into doing anything. Nobody wants to be told, you've got bad brains and you need to take a pill for it. Mm-hmm. Or, it's just a bad situation. And so you have to ask the identified patient, what's in it for you? Let's go back. Tell me about your life. And basically, as the person goes through and tells me about their life, what I hear about are all the different places in their lives that they were frustrated, disappointed, demoralized because they tried to put things right. They tried everything they knew as long as they could, and nothing worked. And they feel totally defeated, and they feel inadequate. And so as we go through with each thing that they identify that was caused by ADHD and its non-treatment, I just say, gee, that must have disappointed you tremendously because you worked so hard to make it otherwise. And you just go through the life, and what they begin to see is all of the places, everywhere in their lives, ADHD has worked its mischief outside their vision. It's not just schools, it's their work, it's their relationships, it's their drug use. And they start saying, yeah, that's me. And I'm kind of the victim of all this.
Yeah.
I didn't choose to be this way. In fact, I have devoted my life to making it different. And everything I've tried that didn't involve medication failed completely. Trying harder actually makes ADHD worse. And that's usually all that's ever offered to them.
Yeah.
So once a person can see, yes, this is a problem which I own, that I've worked on, I'm proud of myself for having survived this long. Medication, I'll give it a try and see what it has to offer. I'm not making any promises to anybody, but I'll try it and see. I'll use my own lived experience to make the decision and not the fear-mongering that I've had my entire life.
Right.
I'll make the decision.
Yeah, like you said, like there's a great deal of confusing information about medications out there, beliefs and opinions too. So for the listener, I want you to make the right decision that will help you first. Nothing wrong with listening other people's care and concerns, but like Dr. Dodson said, like you have to stop being worried about, criticized about people you don't respect. I think that's a good way of putting it. And that's true. A lot of us, we're worried about what the people we don't care about worry about us, not necessarily who love us. I really like the concept of the antibiotic fantasy. It's not a short-term medication. It's something that we need to take for a while. And then one way or the other, you're going to take a medication. I think that's a really great point that you made, either be it a stimulant or non-stimulant ADHD medication that's under a practitioner's control and direction, or you go to alcohol, drugs, and that becomes a disorder, and that's not the right direction we go, because the medication is required to reduce the hyperarousal, like you explained earlier. And you're so right, Dr. Dodson, that willingness, any treatment requires the person's willingness to take responsibility and be personally willing to take control of their life. And that's, I think it's the only way. That's a commitment. It's not just a decision to try, it's a commitment to do. I think there's a really good
For
parts.
yourself. You're
Pardon me?
taking charge of your life.
Yeah, exactly. And no one else can. And I think that's a really good delineation there for us to understand. It's your life, your decision, your care. Take care of yourself. We deserve that. We deserve to self-care for ourselves. So thanks again, Dr. Dodson, for joining us again today. And where can we find you?
Right now, have sort of a low profile. I'm putting the final touches on a book on the treatment of ADHD and the methodology for fine-tuning the medications. And when that comes out, I hope toward the end of this year, we'll also have a website where people can go, clinicians especially can go and get the handouts that show how to successfully fine-tune the medications to optimal performance and no side effects.
Mm-hmm. Oh, that's for clinicians, right? That's directed to clinicians.
It's directed to clinicians.
Yeah.
But sometimes patients have to take matters in their own hand and say, look, we could do better with these medications than we are. Here's this method. Would you do it with me?
Yeah. Cool. Well, I'm looking forward to that book being out to help educate people. And to you, the listeners, how does this discussion change your belief or decision about medication? Let me know. Send me an email at André@theimpulsivethinker.com. I'd love to hear from you. And thanks again, Dr. Dodson.
Good to be here. Thank you for inviting me.
And to you, the listener, thanks again for learning with me. We'll talk to you soon. Take care.